ॐ धं धन्वन्तरे नमः। रागादिरोगान् सततान् शक्तान् अशेषकायान् प्रसतान् शेषान् औत्सुक्यमोहान् हृदान् जघान यो पूर्ववैद्याय नमोऽस्तु तस्मै। Today's topic is role of Ayurveda medicine in the management of Raktagata Vata, that is hypertension. Primary hypertension is usually caused due to chronic psychological stress and altered lifestyle and food habits. Due to increase in activity of sympathetic nervous system, it is usually seen. Due to increased peripheral resistance, which is due to age factor, decreased elasticity of blood vessels, atherosclerosis and subsequent decreased arterial lumen, and increased force of contraction of myocardium, and increased hydrostatic pressure, increased viscosity of blood, and increased blood volume. Systemic blood pressure is raised. The Sarpagandha, Ravalfia serpentina, the root powder is used as antihypertensive. This is the root of Sarpagandha. It is Ravalfia serpentina. This is Ashwagandha, Vidhenia somnifera. The root powder is used. This is the root powder of Vidhenia somnifera. This is Kantakari, sorry, Kuksura, that is Tribulus terrestris. Thus, fruits are used. Fruits are used. Powdered and used. It is diuretic in action. This is Punarnava, that is Burhavia diffusa. The Panchanga and root is used. It is the best diuretic in Ayurveda. This is Gugulu. The Gulu means Comifera mukulu or Comifera wrighti. The resin or gum is used. It is hypocholesterolemia and Vedanahara actions, Rasayana actions is the resin. It is purified by processing it with tripalakwata before therapeutic use. This is the blood vessel, the arteriole or the site of peripheral resistance. The arteriole wall is made up of three layers: tunica intima, tunica media, and tunica externa. Tunica media is made up of smooth muscle fibers, and it is on direct effect on the sympathetic nervous system and parasympathetic nervous system. Sympathetic nervous system induces contraction of the smooth muscles and vasoconstriction, whereas parasympathetic dominance induces relaxation and artericular dilatation. Single drugs used in hypertension: Sarpagandha, Rolfia serpentina, Ashwagandha, Videnia somnifera, Jatamamsi, Nardostachys jatamamsi, Brahmi, Becus munirai, Becopa munirai, and Shankuvishpi, Convolvulus pluricaris, and Tagara, Videnia somnifera, Valeria vallis. Bhokshara, Tribulus terrestris, Puranama, Borhevia diffusa, Mangista, Robia cordifolia, Sariva, Hemidesmus indicus, Chandana, Centellinum album, Hervaruca, Cucumis, Utrimis, Utilismis, Rapula, Curcumis sativus, and Kusha, Desmostachia bipinata stuff. Kasha, Saccharum spontaneum, Nala, Arundo, Donax, Lin, Darba, Desmostachia bipinata, Ikshu, Sakaram officinarum, and Varuna, Kartava narvala, Kamala, Nelumbo nusfera, Shatavari, Asparagus decimosus, and Kumuda, Nymphia alba. So, Pancha, Tana Panchamola, that is Kushakasha, Nala, Ikshudarba. They are diuretic in action. Next, let us see formulations used in hypertension. Pranava Mandura, Sarpagandhavati, Yatamsachurna, Tagara tablets, Brahmivati, Medyavati, and Mandukapandi Swarasa. Here, Pranava Mandura is a diuretic. Sarpagandhavati is a CNS depressant action. It depletes the dopamine from the presynaptic cleft and induces CNS depressant action and also hypotensive action. Etoposicurna is inducing sleep and sedative. Other tablets also hypnotic. Brahmivati is major sayana. Medyavati and Mandukapani Sarasa also major sayana. Anti-stress adaptogen drugs. Shvetavarpati is diuretic. Varunadikachaya, diuretic. Gukshra Churna, also diuretic. Trinapanchamona Kachaya, Gukshra Yogulu. These are diuretics causing excessive expulsion of water and sodium. Thereby, effective blood volume is reduced and the blood pressure is controlled. When we have Madhuvara Guru and Amrata Guru, it is hypocholestemic and helpful in dealing in addressing the atherosclerosis formation. Navaka Lashana Rasayana, Rasona Pinda, these three are hypolipidemic. Tatavare Mandora, Tatpala Mandora, Ilayataloha, and Shilajitavati, they are also acting as Rasayana and diuretic. We have other Shivagutika, Punarnavasava, Manjista Churna. Manjista Churna acts on the blood vessels. Sariva Churna also on the blood vessels. Shila, Shatavari Sarasa, Shilajit capsule, Arjuna Rishta. Arjuna Rishta acts on the heart. Arjuna Shirapaka. Now let us see the actions of drugs and formulations used in hypertension. CNS depressant, sedative. If you analyze the drugs and formulations and their actions, following actions are seen, pharmacological actions in these drugs. They are in Ayurvedic drugs. They are CNS depressant, sedative, hypnotic, anti-stress, adaptogenic, anxiolytic, anti-atherogenic, thrombolytic, and also anti-platelet aggregating, diuretic, Mutravirechaniya, Mutrala, Rasayana, Medohara, Raktaprasadaka, acting on blood vessels, sympatholytic, and anti-adrenergic. Now let us see the examples. CNS represent action, Sarpagandha Ganavati, Yatamsa Churna, and Manasamitra Vataka. Sedative, Tagara tablets, Sarasasarishta, and Medyavati. Hypnotic, Pippalimola Churna, Mamsi Churna, and Shirodhara. And CNS dependent actions, Sarpagandha Churna and Sarasasarishta. Sedative, Sarpagandhavati and Sarasasarishta. Hypnotic, same. And anxiolytic, Yatamsyona, Manasamitrataka, and Takradhara. We have Mutrala drugs, Charaparpati, Pranava Mandura, and Pranavasava. Rasayana drugs, Ashwagandha Srishta, Maheshi Dutta, and Ashwagandhadi Churna. We have hypolipidemic drugs, Medaravagulu, and Navagulu, Lashana capsules. Anti-atherogenic drugs, Lashana capsules, Lashana Kshirapaka, Medavara Mugulu. We have thrombolytic drugs, Lashana Kshirapaka, Kanjana Gulu, and Marichichurna. We have Mutra Virechani drugs, Bhukshira Churna, Bhashana Beda Churna, Ervar Bija Churna. And Mutra Virechaniya Am Bijachurna. Isn't it? Amalaki Bijachurna, Narikela Jala, Ranava Swarasa. We have Rukshana, drugs Navagulu, Ruksha Udvartana, and Svedana. Langana, Turshana, Nitya Virechana, daily Virechana, Devana Pachana, and Pavas. We have Virechana drugs, Triphala tablets, Trivrit Leha, and Abhayadi Modaka. Malavata normal drugs, Heritage tablets, Triphala Pata, Pancha Sakara Churna, Satsakara Churna. Here, Heritage tablets has also the cardiotonic effect. We have Patyas in hypertension. They are, sorry, Panchakarma in hypertension. They are Shirodhara, Nitya daily Virechana, Nabhyama, Tailabhyama. Coming to Patyas in hypertension, Shashti Mudga, Narikela Jala, moderate exercise or rest as per the stage and state of the disease, low salt diet, low fat diet, and high fiber diet. Patyas in hypertension, Atajagarana, Ativyayama, Ativavaya, excessive traveling, stressful activities, nurturing emotions like kama, krodha, lobha, moha, dvesha, isha, matsarya, and raga. Excessive salt intake, excessive salt, fatty food. The yoga therapy in hypertension are Vipassana yoga, pranayama, anuloma viloma, sudarshana yoga, yamaniyama, pala. Coming to discussion. Hypertension is a psychosomatic disease which is common in Indian population. Primary causes like disease of kidneys, heart, and sometimes liver leads to hypertension. Increased sympathetic drive is the commonest cause of the disease. Avoidance of causes like increased psychological stress and treatment of primary disorders like CKD, CCF, etc. are important in the management of hypertension. At first, we have to detect the primary cause and later we have to plan the treatment. Ayurveda drugs and Ayurveda drugs are having Mastishka Shamaka, sedative, anxiolytic, hypnotic, hypocholesterinemic, and antiatherogenic actions are commonly given in these patients. Shirodhara and Virechana, that is in daily relaxation, are found effective to be in the management of hypertension. Langhana, Pavasa, Shodhana, and Mutrala drugs are given in this disease. The treatment of hypertension is lifelong and we have to monitor the blood pressure by regular consultation and counseling. So lifestyle change is also important. Isn't it? Dinacharya, Sriya, Rasayana, Durata, they are also coming to conclusion. Systemic hypertension is a psychosomatic disorder which always needs monitoring and prolonged treatment. On long course, it produces serious complications like LVF, CKD, and retinopathy and stroke. Lifelong treatment is necessary in these patients. By practicing yoga and pranayama regularly, we can reduce the intensity of psychological stress, thereby reduce the occurrence of systemic hypertension and also aggravation of the system hypertension can also be checked by practicing yoga and pranayama. These are the references. So today we have discussed the role of Ayurveda medicine, management of systemic hypertension, Rattagatavata, the visual reference to systemic hypertension. Thank you for patient hearing.